नहीं 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 ये हिडन हो Good morning. Sorry for the little late. I'm Dr. Ramla, Associate Professor from the Department of the Forensic Medicine. So today we are going to deal with the topic of the pregnancy. Why we are dealing that the pregnancy for the forensic? Because sometimes what happened, KG, there are different kind of the disputes arises in the family by relating having the abortions and related with that the some kind of that hairship. So for that reason, usually the court of the law usually calls the doctor to examine and give their expert opinion regarding that the either the pregnancy was there or not. So for that reason, that the medical legal officer or that the forensic expert should know all that the baselines of this topic, like. So, for the sake of this topic, usually we should know about that the duration of the pregnancy, basically, starting from that the onset till that the delivery, uh, till the delivery period, whatever that the changes arises, we should know, uh, uh, very properly. Other than that, for the sake of this, pregnancy is further divided into that the multiple subdivisions, like that the age of conception, like at the time, like usually according to the law, the lady can conceive at the age of 13, but there is a light of exemption is there that she can conceive at the age of the 12. It totally depends upon then the when that the monarchy is going to be take place. And till that the age of usually initially was 45, but can be assumed like up till that the law assume that the pregnancy can be occur up till that the age of the 50. Other than that, duration of the gestation is very important also, and the proof of the delivery, whatever that the changes arises at that period. Okay, these are the subtopics of the pregnancy the one should know. Now that the objectives of the pregnancy of this lecture, like at the end of the lecture, the student will be able to describe what is pregnancy and its duration, signs of the pregnancy in the living, signs of the pregnancy in dead, medical legal importance of the pregnancy in civil and criminal cases. So let's do this. What is pregnancy? Basically, according to the definition, it's a physiological condition developed in the female in her childbearing age due to because of that the fertilization of the ova by the spermatozoa develop embryo and fetus, and the result till its birth. Or we can say it's the physiological condition having at the developing embryo or the fetus in the body from the time of the fertilization of an ovum by the spermatozoa until the birth of the child. The basic is that duration of the pregnancy. This is very important forensically because, usually the cases comes related to that the duration, which is it's going to be sometimes very like in cases of the prosperous child or illegitimate childs. So duration should be it's very much important that you should know about that the total duration of the pregnancy. So how we calculate the duration, like it is termed as like 9 calendar months and 7 days plus minus, or 280 days or 40 weeks. So this is the total duration of the pregnancy, normal duration, calculated from that the first day of the last menstrual period, and also called that the menstrual or the gestational age. Or we divide that duration into that the trimesters, which are called first trimester, that is comprises of first 12 weeks, calendar weeks, and second trimester, that is 13 to 28 weeks, third trimester, that is 29 to 40 weeks. Signs of the pregnancy. Signs of the pregnancy are presumptive signs, like these are the subjective symptoms. Depends upon that the history of the patient, with the patient, what the history the patient usually gives or the person usually tells you. Then the probable sign, these are the signs, the findings which has been noted down or charted down over that the during the period of the examination. And the positive or the conclusive signs, these are the surest sign, can be get by means of ultrasonography, radiography, by means of that the multiple blood tests, blood work. So now deal we will going to deal all them separately. This is basically that the recall for you guys. So presumptive signs, which usually, like, the patients gives you that the history, or you will listen with that the, like, you are that the observer at that time, at that moment. Like, the lady will give you that the history of the amenorrhea. That is the most earliest and most important symptom of the pregnancy, means cessation of the menstruation. So, now the second thing is the amenorrhea could be because of that the multiple other reasons, like, because of iron deficiency. There is sometimes mental distress orders. So it could be like there are multiple DDs for amenorrhea as well. So you have to exclude them out. Morning sickness, that is basically feeling of nausea followed by the vomiting early in the morning of getting up from the bed. That starts from that the first month, or 4 to 6 weeks, up to the 3 months. That is 12 to 16 weeks. This morning sickness is usually being arised like cause because of that the HCl is assumed to be that the major culprit for that, due to that the rising HCG levels early in the pregnancy. Next is the estrogen hormone is also be considered as that the, like, is the one which can cause that the, like, this morning sickness. The third presumptive sign is the breast changes, feeling of fullness and prickling sensation at around that the, like, 6 to 8 weeks, which is gonna be, like, about that 2 to 2 months, specifically in primigravida. Primigravida is the term we use that the woman when get first get pregnant, like for that they become pregnant for the first time. Okay. The fourth condition, like, fourth presumptive sign is that the PCOS of pregnancy. That is like PCOS is like means to craving that the to eat, or like to the things rather than that the nutritional food. Latin major head usually PCOS, it's just like, we call it like the name has been given because of that the magpie, which is notorious to eat each and everything. So there is again that the PCOS should be excluded out with the differential diagnosis like iron deficiency, celiac disorders, like जो है क्या कहते हैं आप वहाँ manifestations होते हैं उसके अंदर भी these PCOS can be appreciated or seen. So excessive salivations हैं due to that the sympathetic disturbances, constipation due to increased progesterone levels, or it is like when that they basically which causes progesterone क्या करता है basically it causes that the slow down that the gut movement. So because of that reason the gut, like, empties very slowly, so it causes that the, like, there is peristalsis will be slowed down, so there will be that the constipation at that moment. Okay. Or the other reason for the constipation at that level is that the increasing expanding uterus giving that the pressure over that the, like, less room to that the bowels to be do its business. Or sometimes because of that the iron deficiency usually leads to that the constipation. Other than that is the irritability and the fatigue, very frequently present, because that's as like hormonal changes. Because of the hormonal changes, this can be appreciated or seen. Frequency of the maturation, basically duration is about 8 to 12 weeks, or we can say 2 to 3 months due to enlarged uterus. Acha ji. Symptoms gradually disappears like as the uterus comes into the abdomen, and again reappears when it descends into the pelvis. Head descends in the pelvis, so it's going to be again gives that the pressure over that the, like, over the bladder. Now we come to that the these were the things which you can only appreciate, like, by hearing, or by that the good observer, or having that the good listening abilities to look for kg what kind of the history the lady is giving to you. Now we come to that the probable sign, which can be seen by means of that the examination, or by can seen by your eye, or you can witness these things. ठीक है जी? So these are that the first of all the breast changes, important in the prima gravida, and less valuable in the multi gravida, because that the once the change is going to be arises, so it's going to be like, that it can be first time changes, because they never like turn back. So once it's going to be changed, it exists for the lifetime. So first changes prima gravida may you can appreciate it very well, but in the multi gravida you can appreciate but not that level. That is, breast become physiologically more active, size become increased due to the hypertrophy of the memory glands, superficial veins, engorgement आपको मिलेंगे. Areola जो है, it's become एरोला जो है वो आपको जो है क्या कहते हैं वो become dark brown in color in the second month because of that the sebaceous glands are enlarged and tubercles are found around the nipple that are called the Montgomery tubercles appear हो जाते हैं. These are the Montgomery tubercles. ठीक है. So there will be that the other than that, pronounced pigmentation of the areola and the nipple, appearance of the secondary areola. This is the presence of the secondary areola. Development of Montgomery typical secondary areola जो है वो basically appears होता है at the second 20th week पे. So you can even see the secondary areola at the level of 20th week of the gestation. We can appreciate it. So you can give your diagnosis on that. 20 weeks ho gaye. Colostrum, that is the formation of that is the first milk. What appears that during the third month it started up formation usually starts in the third month. It's a thin yellowish fluid consisting of fat globules and large phagocytes filled with the droplets of the fat. The second thing that which you can appreciate, that the first you have appreciated on the breast, the second thing you can appreciate on the pelvis, that is the Jacomere sign. Jacomere sign क्या है basically, or the Cadwick sign इसको कहते हैं. Mucous membrane of the cervix or the vagina changes from pink to the violet and finally to the blue as a result of venous obstruction. Acha ja. The intensities can be seen like at the after the fourth week, and the intensity arises. It becomes more darker at the level of 16th week. Okay, at the duration of 16 week, which we called it Jacomere's or the Cadwick sign. Goodell sign. The cervix softens from that they blow upward from the second month onwards. Its softening can be felt by the vaginal examination जब हम करते हैं at about that the 16th week to the 4th month. Goodell signs जो है वो due to that because it's usually seen because of that the increased vascularity of that area की वजह से जो है वो there is that the hypertrophy and the engorgement of the vessels below that the growing uterus. It usually happens. So this can be appreciated at that duration, the second month, and by means of the vaginal examination. ठीक है. Initially, like the cervix is going to be like when you will feel like cervix like a tip of the nose, and the non-pregnant lady, it's a little bit hard cartilaginous. You can feel like cervix feel like the lip of the lady of the mouth in the pregnant lady, like because of that the increased vascularity and becomes soft, and this is the Goodell signs. Acha ji. Osiander sign, this is now it's obsoleted in like examination because what is Oleander signs, Osiander sign, increase pulsation fell through the lateral fornix at the 8th week. This is that the area lateral fornix में आप इसको feel कर सकते थे, but it's not like peak practice nowadays. ये obsolete है, but these two things usually being examined up till now, like in the gynae department they usually look for that. अच्छा जी. Look, please kindly note this thing in everything I'm just mentioning the weeks. So keep this thing in your mind. This is that the basic thing which helps the medical legal officer to rule out how many time has passed up, okay, to make that the diagnosis. So that is the importance of taking all these probable signs, looking for all these probable and the presumptive signs. Now we look for that the uterine changes. First we have seen that the pelvic changes. Now we look for that the uterine changes. That is, first of all, Hagar sign. Hagar sign क्या है basically two finger examination in that the anterior fornix में आप डालते हैं and can be felt approximating that the finger on that the abdominal hand behind that the uterus. उसको fix up करके you can feel like that the both hands can joined together. You can feel your upper hand and your finger in that the uterine area. It is appreciated at 8 to 10 weeks, that is about 2 to 2.5 months, and can be elicited by putting over the one hand. Again, this is written here, over the abdomen and two fingers inside the vagina. The cervix is felt as elastic body in between that the two. The pelvis is felt as a soft, compressible area. This sign is basically more difficult to recognize in that the multigravida. Multigravida is the lady who has delivered like 2 or 3 times. So it's only being appreciated, well appreciated in the cases of primigravida. Then the Palmer signs. What is the Palmer signs? Regular and the rhythmic contractions, which can be felt on the bimanual examination from the 4 to 8 week. Intermittent uterine contractions. These are the false contractions, which we call also called the Brixton Hicks contractions. These are the intermittent painless uterine contractions, are usually felt after the third and fourth month. These last for 1 minute with relaxation for 5 to 20 minutes. Okay, but it's not that much regular now. This is the irregular kind of that the pattern is going to be appreciated there. Ballotment. Ballotment can be done uh, internally through the vagina or externally through the abdomen. It is the sensation felt when the fetus moves in the liquor amni. It is commonly seen at 16 to 20. 16 to 20 पे आपको वीक्स पे मिलेगी. ठीक है. So ballotment के 2 तरीके हैं, मैंने आपको बताया. Externally it's going to be like that, you can feel like putting your hands side by side to the fetus, and you will tap from the one side and you will feel that the sensation on your other hand. Or by means of that the internal allotment, you will strike ping pong ball movement, that some ball has been hidden on your hand. You will just tap the cervix a little bit and you will feel that the movement of something like tennis ball movement can be appreciated at your hand. So it is usually being seen at that they are appreciated at 16 to 20 weeks to 4 to 5 months. Linea nigra, and that the linea nigra, it is the linear pigmentation area, stretches from the umbilicus to the symphysis pubis, visible at early as 20th week. ठीक है जी. लीनियर नाइग्रा बेसिकली क्या होता है? इट occurs because due to the melanocyte stimulating hormones जो है वो रिलीज करते हैं, made by the placenta. Pigmentation is one of the characteristic changes that take place in the pregnancy. So these melanocytes can be causes linear nigra to be formed, and during the duration of 20 to 20 week it also causes the embolisma on the face and darkened nipple area. तो ये भी उसी की वजह से होता है. ठीक है ना. Placenta usually releases that melanocytes. Linea albicans. Linea albicans, like on either side of the abdomen, can be seen. ठीक है. These are the other strias, both pink and white in color. Like linea जो है वो 2 तरह के मिलते हैं हमें. Linea क्यों होते हैं? Linea basically these are the due to the rupture of the sebaceous subcuticular elastic fibers जो हैं उनके destruction की वजह से होते हैं. After delivery become pearly white. So before that pregnancy they are called they are linea gravidarium. They are purple in color, and when it just after the delivery it becomes like pearly white in color, so we called it linea albicans. ठीक है. Enlargement of the abdomen. Enlargement of abdomen is very important to be known by the examining officer, or to look for the duration of the pregnancy. So occur due to that the end of जो है आपको enlargement of the uterus as end of the 3rd month fills the pelvis. ठीक है जी. 12 month 12 weeks. ठीक है. 3 to 4 months over the pelvic brim. 5th to 6th month, midway between that the symphysis pubi and umbilical area. 7 to 8 months midway between the umbilicus and the ensiform cartilage, and 8 to 9 months at the level of the ensifi cartilage, and 9 to 10 months the uterus sinks into the pelvis. ठीक है जी. It is usually being measured in the centimeters from the pubic symphysis to the top of the, by means of the inchy tape. You can use that the measuring tape for that purpose. अच्छा जी. Phonic or the fetal souffle. So soft blowing murmurs synchronized with the fetal heartbeat sound can be heard by auscultation around 16 week to the 4 month due to rush of the blood throwing the umbilical arteries, and the quickening. This is the legal term, means coming to the life. It is a peculiar sensation of the fetal movement felt by the mother, that is from 14 to 20 weeks, that is the 5th month. So this is like quickening, even for the in the PPC जो है वो आपका, whenever we would just talk about the abortions and all that thing, the quickening is the basic thing on which that the law usually focus. कि quickening start, either it started up or not. ठीक है जी. Even for that the like legal abortions, that law is more concerned with that quickening thing. ठीक है जी. Fetal parts. The external features of the fetal can be felt during the second half of the pregnancy through the abdomen, that is by 5th month. But in cases of fatty lady, only can be appreciated in the thin feature person. Like if the lady is gonna be obese or something like that, it's very hard to just feel that things like Other than that, immunological test. These tests depends on the presence of chorionic globin in the serum or the urine of the pregnant woman. HCG can be detected either in the maternal blood or urine. Most earliest can be detected in that the urine is about the like 9 to 9 days, or by 14 days after that the conception can be appreciated, like and that in the blood. अच्छा जी, advantages क्या है इसका? convenient and sensitive है, accuracy 98% है, no animalistic required results quick to miss dipstick testing है. Falsies क्या है? False positive results can be seen like in cases of the hypoformal chorionic epithelioma है, ectopic pregnancies है, so you can get that the positive test for that. ठीक है. Then the positive or the sure sign, which gives you that the like 100% results in the pregnancy is there. That is the auscultation of the fetus heart sound. ठीक है. That is positive after the 16 to 20 week. Fetal heart sounds जो है 160 beats per minute होती हैं 20 week में, and 120 beats per minute होती हैं 36 week में. So this is very important. Like weeks are very important in case of that, to know about that the gestation. Palpation of the fetal part, feeling fetal movement, that is about 60 to 20 weeks again, that is about 4 to 5 months. Radiograph of the fetus, that is recommended after the 4th month because it has its own consequences and drawbacks, so that is the reason. ठीक है जी. 4 month पे हम करते भी क्यों हैं? Because there is a logic. If you have remember your identification portion, के ossification centers जो हैं वो appear ही होते हैं after the 4 month. ठीक है जी. तो center of ossification की वजह से 16 week पे आपका start होता है, so that is the reason, that is the logic behind it is recommended after that the 4 month. Ultrasonography, 6 week gestational sac आपको appear मिलेगा, 7 week में embryo मिलेगा, 10th week में heartbeat, there will be the heartbeat is going to be appreciated on the ultrasonography, and 14 week there will be the head and thorax going to be appeared up. ठीक है. And at like 5th month you can appreciate even the sex of the baby on ultrasonography. Presence of the fetal cells in the mother's blood, it's going to be again like the one of the sure sign. Acha ji. Signs of the pregnancy in the dead, that is the production of the concept, enlarged uterus and underuterine. If you found that the lady was pregnant and it came for that the autopsy and all that thing, then you will be going to focus on these things. So that will help you out in gauging what was that the duration of the pregnancy at that moment. So you look for that the productive conception, TKG, enlarged uterus and underuterine changes, and corpus luteum. So what you will look in the predictive conception, like presence of the ovum from that the 7 to 10 days of graph of milk type, so you can tell KG that is very early. Presence of an embryo from 1 to 9 weeks. Presence of the fetus from 9 weeks onwards. TK presence of the placenta, tissue membranes, and any other product of the concept signifies that woman was pregnant. TK. This is that the examination which we usually done at that moment when the body comes to us and we have to rule it out whether the lady is pregnant or not. TK. Enlarged uterus and other uterine changes क्या मिलते हैं? Mark of the placenta attached are found up to that the 8 to 9 weeks. ठीक है? After the delivery. In doubtful cases, microscopic examination, you can ask for the microscopic examination will reveal the product of conceptions. You look for that the condition of the endometrium and corpus luteum. What is corpus luteum? Corpus luteum is basically it is basically that the hormone secreting a structure that develops in that the ovary in the luteal phase of that is the second phase of that the women's menstrual cycle. Luteal phase begins after that the ovulation. Corpus luteum produces basically corpus luteum का काम क्या होता है? Corpus luteum क्या करता है? Basically it causes क्या करता है? It releases that the progesterone. ठीक है, makes the lining of the uterus thicker for the implantation. ठीक है, it usually continues to develop during the pregnancy and the maximum size is reached at the 5th month, forming a firm projection on the surface of the ovary. However, it is well marked at the time of the delivery and may be evident afterwards, like 1 to 2 months after that the delivery. So this is that the major thing which can help you out, like either that the productive conception is there, like either the lady was about to she was pregnant or not. Okay. Now we come to that these were that the basic recalls and the days and the I just gave you that the duration and the duration because these are the important things. Now we can come to the medical legal importance of the pregnancy. What is the medical legal importance of the pregnancy? Why we are just teaching you the one should know about that the pregnancy. So we divide them in that they either the doctor has to go for that the civil suits or the criminal suits. So the cases comes to that the civil suits are thank you. The cases comes to the civil suits are malicious pregnancy, sometimes malicious person or that the person who wants to harm the lady alleged either verbally or in writing that that lady is unmarried woman or the widow is pregnant and which case it should be defined or that she has to be vindicted herself, she has to clear that blame. Okay. So for that these kind of the cases being run in that the civil suits and the court of the law sometimes ask for that the examination. So for that reason we look for that the we have to rule it out. The age of conception was is very valuable at that moment or some other than that there is the duration of the pregnancy is very important. We have to rule that these things out. ठीक है जी. Concealed pregnancy. Conceived pregnancy like before marriage by the person other than the lawfully wed spouse constitute a valid ground for the divorce. Again, this is that is the reason duration of the pregnancy is very important. ठीक है, जो मैंने आपको इसीलिए सारी चीजें ड्यूरेशन में आपको बताया because we being a forensic person we focus on that the weeks and months. ठीक है. So it's very important when we talk about the legitimacy is going to be the question mark of the past, even that the posthumous child, the child who just born after that the death of of his father or his or her father. Taken it. So in that situation, we have to examine the lady and we have to look for that the duration of the pregnancy can tell us either it was legal or illegal. ठीक है. Other than that, civil case में हमारे पास sometimes we feel we get that the cases of like a woman feigned pregnancy and delivery after the death. Uh, After the death of her husband and produce a fictitious child, her spouse, that is we call as a supposititious, in the legal terminology we call as supposititious child, to the state that belongs to that her husband. In such cases that the person would have naturally succeeded, therefore may apply to court for that inquiry to be made into that the alleged pregnancy and delivery. Now we have that the advancement, but even though that the law usually go for that the something which has been witnesses on the body. So we have the multiple advancement, like we can go for the DNA test and all that thing. But even though after that, law asks you to just call the doctor to just come up and do the examination and look for either that the pregnancy was there or not. ठीक है तो in such scenarios, we have to look for it. अच्छा जी, अदर देन इवन मैं आपको बताती हूँ इलेजिटिमेट चाइल्ड का, जो जैसे मैं आपको कह रही थी कि केस है, देयर वाज वन वेरी फेमस केस वाज देयर, लाइक रोहित शेखर, who is the illegitimate child of the नारायण दत्ता दत्ता जो है वो उनके बेटे थे, लाइक ही इज द वेरी फेमस कांग्रेस लीडर, कांग्रेस पार्टी का. That Rohil Chetty jo hai, he has run his case like for the sixth decade and finally won the case, and his statement was very was famous at that moment. Okay, I was the first in the entire world who just fought for that, just become to prove myself as a bastard child. So जो है क्या कहते हैं, that is the reason that the one has to be very legitimacy और ये सारी चीजें इसकी वजह से we have to go through and we have to look for these kind of changes and all that thing, like it's very important. Ashaji. Other than that, like a woman may claim to be pregnant and file a suit in the court of the law for break of the promise of the marriage or the seduction. So in that case, again, that the examination is going to reveal out either that the pregnancy was there or not. Women may allege that she's pregnant in order to get great compensation from the person. ठीक है, working pregnant women are allowed additional leave facilities. So in that case, and the doctors going to give them that the certificate, again, that the examination is important. ठीक है, now we come to the criminal cases. What in the criminal cases you can be seeing, we counters and we go for the examination. Pregnancy is positive proof of the sexual intercourse in the trial for the rape. So pregnancy may be motive for the suicide of the married or unmarried woman, or for the murder of the married woman by her husband when it is a result of the explicit relationship. So for that reason, we have to look for kg, either the pregnancy was there or not, or we have to look for rule it out. Now, other than that, we counted up in that the court whether the if the women may plead pregnancy as a bar to hard labor execution. ठीक है ना, so usually क्या है कि अगर if she just had that the sentence for death sentence, but if she is pregnant, so there will be that the slight modification now being arises, and that the amendment in that act के जी high court shall commute the sentence to the imprisonment of for the life. ठीक है जी, this amendment has been done in the act with effect from the 31st 12 2019. A woman may advance pregnancy as an excuse to avoid that the attendance in the court, but this is very question mark thing, because if until and unless it's being proved, KG, she is very much critical enough that she cannot attend the court. Okay, so sometimes in the criminal courts, people want to just avoid it and give that the certificate. But in such cases, court of law asks you to just go and examine it. If lady is gone, it's going to be found that false certified, so there will be that the contempt of court going to be applied over her. It is also important in the cases of in criminal abortion and the feticide or the infanticide. ठीक है. there is that the both case like for criminal cases में क्या होता है, women may feign pregnant terms is pseudocyesis or the spurious pregnancy, phantom pregnancy, feigned pregnancy. These are the legal terminology in order to avoid capital punishment. That is section 416. Compel a person to marry, secure more maintenance in case of divorce, and sometimes she assumes herself pregnant. That is the psychological issue. So in such conditions that they we have to examine and give the proof to the court, get the duration of the pregnancy. All these things are very much important in such cases. There are certain exemptions also in the pregnancy. That is twin pregnancy, superfetation, and superfecundation. What is twin pregnancy? Twin pregnancy आपने सुना होगा कि identical twins भी होते हैं, that is or non-identical twins होते हैं, that is the paternal twins. So what are the non-identical twins? Occur when the two fertilized over eggs are implanted in the uterus wall at the same time and form the two zygote are known as the dizygotic twin. Two different sac ban jayenge. So that is non-identical twins and the paternal twins. When a single egg is fertilized to form two zygote, but the zygote then divided into the two separate embryo, which develop into the fetus sharing the same womb, that is called the identical twins. Superfetation, that is fertilization of two ova discharged from the ovary at different period of the ovulation. We called it superfetation. Superfecundation, fertilization of two ova discharged from the ovary at the same period of the ovulation by two different acts of the court is committed at short interval. Okay. These are the conditions which are very much important, questions of like especially this one fecundation. These are the legally being dealt in cases of adultery, infidelity. Paternity cases may arise if there is gross variation in the racial characteristics, or that there is morphological features. Because maybe the lady has done the two different intercourse with the two separate persons. So these kind of the things can be we have to look for that. So this is all about today's lecture, and inshallah in the next lecture we will look for that delivery, because once we just go through with that the pregnancy and delivery, the basic things, we will be able to know about that about the abortion things, which is very much important for that the legal point of view. Thank you very much. Any questions? Hello.
अस्सलाम वालेकुम।
वालेकुम सलाम।
जी मैम, लेक्चर आपका कंप्लीट हो गया पूरा?
जी बेटा हो गया।
बस मैम जो क्वेश्चन जो आपके पास आ रहे हैं आप उनका रिप्लाई कर दीजिएगा, क्योंकि मेरे पास तो कोई क्वेश्चन नहीं आ रहे हैं स्टूडेंट्स के ना।
अच्छा, मेरे पास 4 क्वेश्चन आए हैं। अच्छा, मैं देख लेती हूँ। ओके, क्वेश्चन है स्लाइड्स नॉट मूविंग, ओ माय गॉड। ठीक है मैम, कैन यू गो अ बिट स्लो प्लीज? ओके, आर वी सपोज्ड टू मेमोराइज ऑल द टाइम milestone at these signs? Acha ji, beta, slides are not moving. This is something it's very hard to just understand, okay, because from my side I don't have any such error. So I'm sorry for that, but I'm gonna be uploaded it on today at LMS. You can get it these slides from there. Can you go a bit slow, please? Inshallah, I'll take care of it. If you think that I'm very much fast enough, so I'll look for it. Take care. I'm sorry for that. Number 3rd, I have that they chat about. Are we supposed to memorize all time milestones? All these signs appears on? Yes, because for the being a forensic person, or even sometimes you never know where you're going to be appointed up. Like if you get that the government job, you may be appointed as medical legal officer, so then you should be go for it. Or sometimes what happened, कि आपको जो है क्या कहते हैं ये सब चीज़ें देखने पड़ते हैं being a doctor even in your practice. So because court asks you from the institution, can you send the doctor for the examination, then you are going to be, if you're going to be the gynecologist or something like that, then you should supposed to be go there and answerable for all these questions. ठीक है. Other than that, Miss Productive conception नहीं समझ आ रहा. Okay. Productive conception क्यों नहीं समझ आया बेटा? Productive conception आपका जो आपका fetus है, that is the productive conception basically. ठीक है. So it usually depends on the age of the productive conception. कि क्या एज उस पर डिपेंड कर रहा है, कितने वीक पास ऑन हो गए हैं. प्रोडक्टिव कंसेप्शन क्या है आपका? बेसिकली फीटस ही है. ठीक है. द लास्ट स्लाइड वाज exceptions to what? Exceptions to the normal pregnancy. Beta, these are the exceptions to the normal pregnancy because twin pregnancy is not normal. Twin में भी आपके पास दो तरह की pregnancy होती हैं, superfetation and fecundation. These are not the normal pregnancies. ठीक है. So that is the exceptions. अच्छा जी. How is superfetation different from that twin pregnancy? Okay, let me explain it to you. It just hung up. Let me just explain. देखो बेटा, fertilization of the two ovaries. ठीक है. Two ovaries discharge from ovary at different period of time. ठीक है. Different period of ovulation. ये क्या है? इसके अंदर आपके पास दो पीरियड ऑफ ओव्यूलेशन होंगे. ठीक है. ये सेम टाइम पे हो रहा है, जो कुछ भी हो रहा है इट्स अबाउट द सेम टाइम, बट ये डिफरेंट ओव्यूलेशन है. लाइक दूसरे ओव्यूलेशन में इसमें आपको क्या मिलेगा? द वन चाइल्ड इज गोना बी फुली डेवलप्ड एंड द अदर इज गोना बी लेस डेवलप्ड. ठीक है. तो ये चेंजेस होती हैं इसके अंदर. अच्छा जी. अदर देन दैट, ठीक. तो इज इट क्लियर टू यू? ठीक है. ये ओव्यूलेशन ड्यूरेशन इसका चेंज हो जाएगा बेटा. ये टू पीरियड है, डिफरेंट पीरियड ऑफ ओव्यूलेशन में आ रहा है. ठीक है. ये सेम ड्यूरेशन होती है ओव्यूलेशन पे. अच्छा जी. सुपर फेकंडेशन आप कह रहे हैं, मैं आपको बता देती हूँ. आई थिंक इट्स क्लियर टू यू कि सुपरफिटेशन में क्या डिफरेंस है ट्विन प्रेगनेंसी में और सुपरफिटेशन में. This is happening at only at the same ovulation duration, and it is about the different period of ovulation. Superfecundation, इसमें क्या है कि ovulation ड्यूरेशन आपका सेम है बट डिफरेंट एक्ट ऑफ कोइटस की वजह से देयर विल बी द टू डिफरेंट एक्ट ऑफ कोइटस जो है वो मल्टीपल इंटरवल की वजह से. दिस इज लाइक दिस इज फॉर, मैंने आपको बताया कि जो है क्या कहते हैं, दिस इज वेरी मच क्वेश्चन मार्क इन केसेस ऑफ जहाँ पे आपको रेशियल डिफरेंसेस भी मिलते हैं कि लेडी हैज बीन डन द इंटरकोर्स विद द टू सेपरेट पर्सन. ठीक है. तो यहाँ पे आपको दो जो है वो डिफरेंट आपको फीचर्स भी, रेशियल डिफरेंसेस भी मिलते हैं. दिस इज डॉक्यूमेंटेड एज वेल कि एक बेबी जो है वो फेयर कॉम्प्लेक्शन का था, एक निग्रो था. तो इवन दिस इज रिटन इन द केसेस हैज बीन सीन लाइक दैट इंटरनेशनली. ठीक है. Acha ji. Other than that, when the school will open, I cannot comment on this. Most probably, we were just planning for and till the 15th September, there will be that we were just doing the meetings for it. Like in cases of for the sake of practicals and all that things, maybe we'll just like give the invites for that for the sake of practicals and all that thing, but not like in the small groups. So it's not decided yet. So let's see कि ये कब decide होता है. ठीक है. कॉर्पस ल्यूटियम जो है बेटा, बेसिकली इट्स दैट दी हार्मोन सिक्रीट करता है. दिस इज दैट लाइक इट्स अ बॉल शेप थिंग व्हिच कैन इजीली बीन अप्रिशिएटेड बाय दैट इवन दैट नेकेड आई, एक छोटे से बॉल की तरह बना हुआ होता है. और इट जस्ट टेक दैट दी ह्यूज लाइक यू नो, आपको मैं बताती हूँ कॉर्पस ल्यूटियम का कि उसका पूरा जो एक मच्योर अब जो हो जाता है, that is reach at the fifth month, forming a firm projection. एक फर्म प्रोजेक्शन फिफ्थ मंथ तक ये बना लेता है उसके ऊपर. ठीक है ना. तो ये रिग्रेस नहीं, रिग्रेस ये कब होना शुरू करता है? आफ्टर द डिलीवरी. लाइक इवन यू कैन सी और अप्रिशिएट, अगर डेड बॉडी आ रही है तो अगर डिलीवरी हुई भी है उसके अंदर, तो 1 to 2 months जो है ना वो वहाँ पे उसको आपको कॉर्पस लूटियम के ट्रेसेस मिल जाते हैं. So it's very easy because I have seen by myself, like while performing that autopsy के लेडी डिलीवर्ड हुई भी थी पहले की, और कॉर्पस लूटियम बहुत उसका बहुत प्रोमिनेंटली पड़ा हुआ था ओवरी में. इतने छोटे से होते हैं ओवरीज आप जब आप डिसेक्ट करते हैं तो. ठीक है. So hope I have cleared my, like you know, I just answered all your queries. The first thing which I really appreciate that you pointed out ke I'm going in a fast pace. I'll try to be slow in the next class, inshallah. You won't get that any kind of like complaint from my side, inshallah. ठीक है जी. Other than that, best of luck. Take good care of yourself. Allah Hafiz.